You're pulling this tissue up and then pushing the tissue down. And oftentimes you can actually take the muscle and push it off of the bone as you come down. So lifting that muscle, pushing it down into the bone, and then peeling it off of the bone. I can change my direction if I feel like I need some of the stroke to emphasize, like there's a tightness to the muscle right here. I can focus in one area for a while. I don't always have to try to pull it from the posterior and push lateral and medial at the same time. I can take one segment of the muscle and do the same technique. So I'm pulling now this part of the muscle towards me and then pushing it this way and using his bone as something to push the muscle against. Working patiently through the layers. I feel like there were certain parts that I could have sort of accidentally pressed too forcefully and actually made his muscle jump. And if you can prevent doing that is good, because once you start making their muscles jump, oftentimes they'll kind of tense up, kind of worried that you might do it again. So you have to find the areas with your assessment that are sort of tighter and that you need to sort of work through the layers more patiently. Now this rectus femoris, this middle quad, attaches to a tendon and goes right over to the lower leg. So as you're working the tissue, it's nice to get it all the way to right around this knee, to carve out this tissue right around the knee. And in fact, as you get to either side, I'm on either side of rectus femoris right now, there is the deep one, vastus intermedius. So as I'm peeling this tissue with my fulling, I basically want to make sure I get that all the way around the knee as well. It is a very common phenomena for muscles that could operate independently to get glued together with excessive scar tissue, those protein fibers like collagen, elastin. And then when they get stuck together and they cannot operate independently anymore, somebody loses what used to be the freedom and flexibility in their motion. And in the case of the leg and the knee, sometimes it'll go to the extent that their knee will not track as well if we have excessive force pulling either laterally or medially. I could do the same fulling technique but involve larger surfaces of my hand and forearm. So I'm basically going to lift the tissue up, squeeze it together, and press it off of the bone. But I'm going to use bigger tools basically by taking my whole hand. It generally feels really good to take muscles and lift them off of the bone, squeeze them and flush them off. It's quite a kind of a physical technique because you're having to basically peel a whole muscle off. What's that pressure?
6.
Okay. I'm feeling with my elbow a tighter spot in vastus medialis as I squeeze it into the tissue medially. Similar to when I started my effleurage, I can basically take that all the way from the posterior leg. Really nice thing about the working with the person anteriorly is that you can take a lot of the strokes and work all the way to the back of the thigh. And in fact, you can work with the back of the leg so well with the person anteriorly that if you're going to not have time to undrape everywhere, you could skip undraping the posterior when they're prone. You could skip undraping them posteriorly and work the entire leg really well when they're anterior. So I'm basically taking the fulling technique all the way around the thigh now. And I'm finding where there's tight spots, squeezing, squishing, and pulling it against and then off of the bone. You can add rocking and bouncing and traction as well. All of these muscles cross over the knee, so you can integrate them. Taking a wall of tissue with my elbow, so I can pull it in.